Hi, everyone. It's great to be here at the PM for the World conference. Today, we're going to talk about elevating the impact of health services in Tanzania. I'm Deanne L, founder and chairman of the board of Project Managers Without Borders. So, in this case study, I'm going to talk briefly about how we came to volunteer our project management skills with this team and give you the context of which the project was done and various aspects of the planning and the execution of the project, and then the impact and lessons learned that we went through and we were able to accomplish from this project. In the end, getting to the very end, so you don't have to wait to the very end to recognize what the key takeaway is. It's really clear that applying volunteer project management skills and knowledge to support charitable organizations through our contributions is really impactful, both in this project and also going forward. So we'll talk about the SCL Health project background. And in this case study, I'm going to talk briefly about how we came to volunteer our project management services with this team and the context in which this project was done. There are all sorts of aspects of planning and execution of the project we'll review, and then the impact and lessons learned. So we'll go through all of that. But to cut to the chase, in the end, it's really clear that applying our project management volunteer skills and knowledge to support this charitable organization was very impactful, both in this project and also going forward. So we'll talk now about the SCL Health project background. The situation is that in Denver, Colorado, in the United States, there was a hospital that was 141 years old, and they were going to commission this hospital. They were going to move all the personnel to the new hospital, the property that's right next door, but they weren't going to move all the equipment. So some of it they would auction off, and other equipment they were planning on donating. And so the way that they did this is throughout time, they've been doing medical missions to Tanzania and other places in the world. And they planned to donate all of this equipment in their next medical mission. And the reason that they weren't moving that to the new building is they wanted all state of the art new equipment in the new hospital. So when they looked at where they were going with this, they saw the next mission was going to be in Arusha, Tanzania. Now, I happen to know a person who had been on 2 previous medical missions with this group, and that person thought that it would be absolutely wonderful if I joined this organization, if our organization joined this mission to improve their outcomes. So that's what I did. I went to a meeting with them and to introduce our organization, Project Managers Without Borders, but then also to learn what they were doing. And so we went to this meeting and it was on their premises. There were about 7 people and they wanted to start off with introductions and they asked me first. So I introduced Project Managers Without Borders, recognized that we apply our project management skills, volunteer skills, to not-for-profit organizations that have humanitarian purposes. And the point of that is to make them more efficient and effective through project management and to support them in achieving their organizational missions. And the real point of it is to improve the good that they already do. Well, then other people started introducing themselves. And the first person started, that was Sister Jen, and she's from SCL Health. And she explained that her organization was sponsoring the mission and they've done many others. And she was really excited to be there. And she was excited that I was thinking of being involved because they really needed project management help. They really wanted PMWB to support their effort, which felt great to me. And then we went on and other people introduced themselves. And as they went, almost every one of them, maybe every one of them, said at the end, "And we need you," which was fantastic. I don't think it's very often that you explain what project management is and how it can help somebody or an organization, and they embrace it so fully. And so that was absolutely exciting in that space. So here we're going to talk about who these people were, who the key stakeholders were. If you look at the top, we have SCL Health. That was our sister Jen I just talked about. She's the sponsor. We had St. Joseph's Hospital. That's the hospital that's being torn down and rebuilt, but not in that order. It's a source of clinical, biomedical, and IT volunteers. So, those are the three groups that are going to be going on this mission from the hospital, and they have various goals between them. Obviously, we have our organization, PMWB, and we're the source of the project management volunteers. There's Arusha Lutheran Medical Center, called ALMC, and they're the clinic and the hospital that are receiving the support in Arusha, Tanzania. And then there's a second one, was actually the first one created, that's related to ALMC. Celian came first, then ALMC, and it's another recipient of goods and services for this mission. And then lastly, from an organizational perspective, our last stakeholder is Arusha Technical College. And they're the students that were hoping to learn about technology, not necessarily medical technology, but this group, the IT group, is going and installing all sorts of equipment and doing a lot of work, upgrades and things. And they were going to be on site to learn. And so really impacting more of the community than just the hospitals. So, as I said before, this was not their first medical mission. St. Joe's Hospital went on missions several times in the same area, but this one was different. They had a huge amount of equipment, not an entire hospital's full, but a large amount of equipment and supplies that they wanted to share in this mission. And if you look at these photos, you can see the upper left one has a lot of equipment that's wrapped in plastic. They're incubators. The one on the right, the upper right, shows the actual container after all of the equipment was packed up. It was just full to the brim. And the lower one is just people filling up boxes with the supplies. So what they really needed and wanted was more sustainable impact for their mission. And they thought that time was going to be more complicated. And of course it would be. We had all of the shipping to do, but then also applying project management to any of their concerns and all of their efforts, all of us believed was a very positive thing. When you look at the shipping part, our organization, PMWB, our project management, was not involved tremendously in that. The team knew what they were doing. They had shipped items previously, just not so much. And so we let them move forward without our support in that area, which worked fine, but we really were able to have a great impact in other areas. So it's important to recognize that the team didn't identify many goals up front because of the knowledge that they already had. The prior experience that they had showed that so much would be outside of their control when they got on site. So they had done these missions before and they had kind of given up that concept. Why would you do goals? We don't know what we're going to find. And so they kept finding various things, but what we identified that they could recognize and accept is that if they put those goals up front, if they recognized and recorded goals up front, then that would keep their focus on them. In the beginning, they felt that the concept of a goal, they resisted it because they felt that it might reflect badly on them as individuals if there was something that they couldn't accomplish that was a goal, because all sorts of circumstances would be out of their control. So we did convince them. And by setting these expectations, we were able to lead with these concepts in the forefront. And so they really did keep them in mind. Now, there was an obvious large goal of getting the equipment and the supplies there. And that work stream, since I mentioned just a minute ago, they were working independently. They We really didn't have any involvement in it. It was really interesting. I was really surprised at how long it took to get the equipment over there. It went from Denver to Minneapolis, also in the United States, to Nairobi in Kenya, and then Dar es Salaam in Tanzania, and then Arusha, Tanzania. And as it went through, every one, some of them may have had customs, some of them unpacked, repacked. So it was a really interesting effort. I didn't, unfortunately, get to see too much of it, but I know that it was a lot of effort that went into that. So now we'll talk about the project goals. And as I mentioned before, there are three teams: the medical team, the biomedical team, and the IT team. And biomedical, well, I'll talk about that next. So the medical team, their key goals were flexible training of the local doctors. So the very first word of the goal is flexible. And they really needed to, because what they were planning on doing was going there and observe. They're going to observe and provide surgical or advisory training afterwards, after when they identified what it was that was going to happen, what they were observing, they realized, this is an area that really needs some support. But they couldn't know that ahead of time. The communication between the groups across the continents wasn't very strong, and it wasn't very specific either. And so they didn't have a whole lot of knowledge about what they were going to be running into. And so they also needed to base it on the patients that they saw. They didn't know what patients would come in, what sorts of ailments they would see, and what procedures they would encounter. So an example of that is seen in this photo. You have a medical team in Arusha, and it turned out that they didn't have the knowledge about CPR, which is cardiopulmonary resuscitation. They weren't familiar with how to do this in a very efficient manner and effective manner. And so the doctors ended up teaching that right away. One of the first things that they observed was this, and they observed and trained immediately. And so that's what their goal was, to look at what's happening and train the local doctors and nurses. Another area that we mentioned to them was tracking baseline data. It's not a concept that they really had in mind. Previously, it was just show up and do whatever good we can, which is fantastic. A lot of good was done in a 2-week period every time that they went, I'm sure. But this time, we asked them to track the data, because if we knew how much of anything was happening, then we would know how we could improve it going forward. So they had a new goal this time, which was tracking this data. So one of the things that they did, that we encouraged them to do, was report out daily of, log what they did, log what issues they ran into, and what kinds of lectures they did, how many people showed up, those sorts of things. And one of the key points that they ended up sharing up front, that turned out to be, of course, true later on, is that from a patient safety perspective, it's really difficult to measure at an organizational level. There are a lot of things that are difficult to measure, which we know, but at least they could track what they could see and start sharing information that might make a difference going forward. Planting the seeds, so we say. Now, the next area that we looked at was biomed. And biomed basically is all of the equipment that is not servers and monitors, meaning the computer equipment, the general computer equipment. It's the equipment that's specifically medical related. And so all the stuff that you see here, you can see an incubator and other things like that, medical monitors, that's all biomed. And so their goal was to install, make everything operational that they install, and train on everything that they install. And the three areas that they really wanted to concentrate on were the central monitoring, the infant ventilators, and then also endoscopic equipment. Now, the endoscopic equipment was there, the infant ventilators were there. Turned out the central monitoring didn't even show up. So from the beginning, I'm getting ahead of myself. Those are the results. But from the beginning, that was one of their goals. It was their first goal. but the equipment didn't show up. And so we'll talk about that in just a little bit. And so the other thing that they had that was a goal was to support the medical team. And anything that happened on the medical team when they were observing the first week, that could lead to a change in what the biomed team did. And so they really had to be flexible as well. Their priorities were set by the medical team. Now, on the IT side, their team was focusing on something similar to biomed, but their equipment was IT equipment versus medical equipment. So they had upgrades. They had something like 57 computers that they were installing that had, that ran the organization, that ran the hospitals, that did billing, that did patient records and things like that. And so they upgraded a lot of computers. They were going to migrate data, and they really wanted to make sure that the group themselves, the hospital, knew how to support this equipment going forward. And so a lot of their goal had to do with training the people that were already there through ALMC. The last thing that they wanted to do was upgrade the network. They sent all of the equipment to do this, and that would make it so that the two different hospitals, the hospital and the clinic actually, Celian and ALMC, would both be able to talk so that patients could go to one and have their knowledge, their information for their patient records also available at the other if they ever ended up going over there. Well, there were a couple of special projects also that they wanted specific goals for, and those were the intensive care unit and college training. I already mentioned that there was this college ATC that wanted to be involved, and since we had IT people there, we wanted them to train the people at the technical college. And so the other was that the intensive care unit monitoring should go in place. Intensive care unit is exactly what it sounds like. When there are some people that really need special medical care, they didn't have a way to monitor vital signs previously. And so they really wanted to install this. It just seemed like the impact would be so great if they could monitor vital signs in a situation where somebody really needed this kind of care. And the team sent extra nurses to use as the eyes and the ears to determine the quality of care in the intensive care unit. And so that was really a special focus area for them. The last area of goals that I wanted to mention were the volunteer team goals. This is an area that we had to encourage them to look at. We had to encourage this team of medical and technology volunteers. We had to tell them that they're also stakeholders. Of course, they're doing all this work and they're going out and sharing their skills and knowledge, but it was important to recognize that we needed to continue to have volunteers for future missions, medical missions. And we also wanted to have repeat volunteers from this team. And so when we put it that way, they recognized it was very important to see themselves as stakeholders. And they came up with two goals, which are absolutely fantastic. They both really lead to them repeating the rewarding experience. So they identified that members of the team should come back with such a positive attitude that it stimulates interest in future missions for themselves and for others. And then also, they wanted an enjoyable, educational, and rewarding experience overall. And so setting those up was in their minds from the beginning. And so it would be clear that that's something that they would strive for. Risks. One of my favorite topics is risk. And it's really where I think we made a lot of impact in this project from a project management perspective. The team's attitude about risk was that there was a lot that they needed. There was a lot of risk. And because there was so much risk, they really just needed to be flexible, which is a fantastic position to take. It is important, but they figured then they could handle anything when they're on site. But one of the things that we talked about, and we had the meeting biweekly and then eventually weekly before their big trip. One of the things that we talked about was, of course, status, but risk. And we identified the risks that they knew about from prior prior trips and issues that they knew that they would come across. And so we reviewed these in these meetings. We also added some formality to their approach. So together we identified risks and responses so that they would be prepared and in some cases could avoid entirely the negative impacts. So I heard a lot of stories from these prior missions that helped us identify these risks. The very clear one is we just don't accomplish everything they want to accomplish. That's super high level. But since so much was out of their control, and we'll go into that in just a little bit, it was clear that we did need it to be at that high level. So, what if we just don't accomplish everything? And, they kind of looked at that as well, it's okay if we accomplish something, then we've achieved our mission. But we thought it was important to quantify that, to take the baselines and figure out how we could improve it going forward. Another item that they came up with was really kind of weird to me, which was missing out on the personal connections. They were going to be there, they were going to witness what was happening, observe, and they thought that they might focus too much on their tasks. And if they were focusing too much on their tasks, they wouldn't get the human connection. They wouldn't figure out how the equipment was really impacting the people. Maybe they would train people on it, but did it scare people, for instance? Did it have any kind of a negative impact? Or was it all just they didn't even want any equipment in the room? Or was it that the doctors were afraid of learning too much, or the even worse, the clinics were afraid of their doctors learning so much that they might lose them. They might go someplace else that would pay more. So those personal connections were really important, and they definitely wanted to make sure that they hit those. And then the last was they didn't have consistent access to electricity. In the area, they always had these brownouts. They would sometimes be blackouts, but then they would lose connectivity. And it was really hard to get things done on a computer, and then also some of the medical equipment as well when this would happen. And so they didn't have constant access to electricity, and they didn't have constant access to their storage room. And their storage room is a point that we'll talk about in a minute. So those are their risks, their biggest risks. And right now we'll talk about the responses. We worked on these together. The first one, if they would just prioritize the tasks so that their most urgent ones were done first, and then they would recognize that, yes, of course, we're not going to accomplish everything, but we did accomplish something. In fact, the most important, the most urgent tasks. And then if they logged everything, then they would recognize their successes that maybe they would forget at the end of the 2 weeks. So daily, they started logging their experiences. We also identified that they could create a flexible schedule to make sure that they scheduled in those connections with people and certain people and groups. And then lastly, from an electricity perspective, this, I think, is the most important thing that we did, the contribution that we did as project managers. And that was that we created a cross-role support matrix. And this was a fantastic opportunity to help them make the most of their time there. When there was power out, the IT people couldn't get anything done. All of their work required power. But what they could do was go over to the medical team and hand them tools, equipment, a scalpel, those kinds of things. They could do that. They didn't need specialized skills for that. They just needed to be there. And so what we identified was that we could create an entire matrix that said, when IT can't do something, they can help with this in the other spaces, in the medical space, in the biomed space, and vice versa. There were all sorts of things that the doctors could do to help out the biomed team or the IT team. And so creating that got us through all sorts of roadblocks that otherwise that they would have run into. So project implementation. At this point, we've accomplished a lot of planning, but what actually happened? And when they actually got there? I'm sure you're waiting to know. So our first impressions, well, their first impressions, I should say, we weren't in on site. The project managers were not on site. It was all of the work up front and the planning. We provided all we could up front, and they left and they started their work. And we didn't even hear what was going on until they started sharing some of their daily thoughts, which was a day or two later. So we were just sitting there for a while wondering. But we learned their first impressions were, like I said earlier, not all the equipment arrived. So that was really disappointing. That was the biomed's concern, main priority was the monitoring, and that was the main thing that didn't arrive. There are other things that didn't arrive, but with all the hands that touched it in between, things disappeared. And when they got there, all of it had already been unpacked. So they didn't know if maybe it had been shared with a different clinic or, in any case, obviously there was room for improvement in that going forward. In the medical space, the medical staff on site hadn't allocated time. The director of the hospital wasn't communicating with the doctors in the hospital. And so they were all kind of surprised to see the team showing up, and they had plans. They couldn't just drop everything that they were doing. Of course, they couldn't drop emergencies and patients that came in, but there were other things that they were doing and they didn't see the value. So they didn't really allocate the time that the SCL health team thought that they should have. So those were a couple of negative responses or impressions from the beginning, but the last two were really positive. So the ICU monitoring equipment and the UPS, the uninterruptible power supply, were both available from the beginning, and got installed first thing. The UPS made it so that the brownouts weren't such a big deal. Because it would make, if you lost power and then the UPS kept power up. And so you didn't have to start over or anything like that. And so that was super valuable from the beginning. And it really kind of boosted people's spirits. So the team adapted. They were hit with a few problems up front, but they expected a few problems up front. They didn't know what they would be. They didn't know at all. Of course, they always knew that there was a risk that the equipment wouldn't get there, the big shipment, and they knew that little bits might not get there too. So that was sort of accepted from the beginning, knew it. We had to accept it, move on. But the key is that this was a very resilient team and they adapted. They got into the swing of things. And so they observed. The medical team started observing. The biomed team installed the infant ventilator. They started using it on patients as they came in. I think they had only one where they had an opportunity to use it, which was absolutely fantastic to have the opportunity. You never know what's going to happen during the weeks that they're there. They did run into some cultural issues. There was a person whose responsibility it was to keep the storage room locked, and that person wasn't very available. So they went into the storage room where all of their equipment was going to be held, and it was a big mound of equipment that they had been replacing over the years. Organizations would come and support them, and they'd replace their equipment, and they have a scarcity mindset. So they would keep all of the old equipment and just literally piled it into, you can just kind of imagine a big pile of treasure, but this was equipment that probably would never be used again. But they ended up getting a lot of things done in the second day, certainly. After the first day, the shock was over and they really got to going things. The network was upgraded, providing a huge improvement over what they had. They could now connect the clinic to the hospital and get those patient records. Speed wasn't really as high as they would hope because of the provider, but they still had that connection and upgraded all of the equipment. In the end, when you look at all of the different goals that we just looked over, they really accomplished almost all of them and were very happy at the at what they had been able to accomplish. You look at all the teams on this slide, and so much of what we talked about was accomplished, and they could feel really good about it from all of those perspectives. But what was the true impact? We're going to talk about the actual impact that the project had on the various stakeholders. Those stakeholders are shown here, and there are 8 of them. And the last 2 are what I'm going to talk about now. I've got a slide for all of each of the others, but those last 2 are things that people don't tend to talk about. The project managers that were volunteering, they weren't even on site. But there was a huge impact on us, right? We learned, we felt fantastic personal satisfaction that what we had done was making a huge impact on people and organizations. And we had the opportunity to give back from our professions. So that's huge impact. Just looking at that, I think that usually people don't look at that from the beginning. And I just wanted to mention that was fantastic. And on the other, even broader than that, from the profession and Project Management Institute, an increased awareness of project management and its value across the world was felt by this, which is not a small task. But when you think about everything you do in project management, that is a potential outcome. So let's look at the impact on hospitals. There were 2 hospitals that we talked about. One is a hospital, one's a clinic, actually. And with the ICU monitoring that I mentioned earlier, vital signs of patients could now be taken so that they could actually know, the heart is racing or the breath is too shallow. Although I suspect that's something that you could be able to tell without a monitor. Realize that's not my forte. Project management is. When they used the equipment, when the doctors left, they figured they were getting about 90% of the value just from the training that they were able to get in a week's time. All of the equipment that was intended to be upgraded was. So they were able to upgrade the computers. Of course, the central monitor didn't show up, so that wasn't an upgrade anyway, but they didn't get to do that. The supplies were appreciated, but they were able to take better care of their patients because of all the boxes of supplies that they got. From a sustainability perspective, patient care and safety is a long-term process, and they really had to recognize that. They wanted everything that they did to continue and be accepted and propagated, but they knew that often what wouldn't happen was the training of other people. When they left, the people that were trained, and that's it. They'd use the material, the information on the materials, and that was it. They knew that the training wouldn't continue. And so what they're working on is identifying for next time how to improve that going forward. So it was really important that they recognize that. Of course, that's in our lessons learned, but recognizing also who's responsible for it and having that person talk with them about what he can do going forward. So the 57 computers were installed, and the staff from the college were trained on how to install and do upgrades in that space. Now, the impact on doctors, nurses, and students. I was just mentioning installations. Those students had the opportunity to install and be engaged throughout of all of the IT installations, the network upgrade, and all of those sorts of things. They hadn't had any opportunity to get their hands on equipment previously. And since there were monitors and other equipment that were replaced and upgraded at the hospital, that school got a donation of equipment that they could work on going forward as well. From the doctor's perspective and the nurses, they got training in CPR, certainly. They got training in other areas as well. There were multiple cases that came in, and instead of usurping the authority of the doctors and the nurses, we had people observing. And the doctors from this mission would share with them information afterwards to improve quality of care, give them a different perspective, and actually show them how to use the new equipment to improve their outcomes. So, one issue that they did run into is, as I mentioned, they weren't very engaged in the beginning. And so, what happened was they needed to get with people, the administrators of the hospital, and help them understand the value of this skills fair. And the first one wasn't well attended at all, but they had a second one after socializing the concept and helping people understand how valuable it would be. And a lot of people attended the next skills fair. When we think about impact of a project, usually we think about the impact on community. This is what people usually mean when they say, what was the impact? And of course, the impact was great. There were 7 scopes added so that they could look into endoscopy. That led to greater diagnoses and more accurate diagnoses. Vital signs are monitored. It's hard to imagine how that impacts. I don't have numbers, but just having vital signs measured would impact outcomes. They would have to. Of course, we don't have measurements, but you could see that this would be. The training that on patient care and safety led to a more consistent standard of care. Standard of care was not something that they talked about before. It was you got the doctor that was better or you got the doctor that wasn't as good in the area that you needed help. And they started making things more consistent. With the power outages, they didn't have to worry as much with the UPSs that were installed. And that would impact patient care as well if some equipment that was really needed was going to go down because of a power outage. So these are the areas you look at and you say, I feel so good that the community, these specific people on the screen were helped. They were at the clinic. And I don't know what the particular instance was, but they were helped, and they were helped more so because of what this mission did and the volunteers. And speaking of the volunteers, they're also a stakeholder. And these are the volunteers from SEL Health and St. Joseph's Hospital. They recognize their own contributions, but all of the people that are standing with them from the community and all the people that they addressed, and they had that welcoming, they had that appreciation from the community, and that really helped a lot. They had a lot of setbacks and disappointments, which is important to mention. It's not just a happy story. There are opportunities for improvement through their setbacks. One of the key setbacks was that what they were doing really it didn't seem as appreciated as it should have been by the director of the hospital. He actually left halfway through their mission because he had something else planned, which seemed like it seemed pretty rude actually to the group because he was supposed to be coordinating things, or at least they thought so. So an end out of that is obviously we need to set expectations. They got to see the communities and the issues in a unique way. And one thing that we didn't even talk about ahead of time is they had the opportunity to provide personal financial support. Just going to a place where there is a lot of need provided them that opportunity. Of course, they saw that there was an opportunity as well to make more of it in the future if it were supported, consolidated in effort. So look at the big picture impact. ALMC got better confidence from their staff. There was a conversation about gender equality. Don't know where it's going to go, but it was a start. They improved their hygiene. The skills and knowledge of the patients as well as the doctors improved. And the attitude toward training of everyone involved that was trained totally was improved. And this is my favorite part, the impact report. This is the final report that we created out of the project. And this is the executive summary. You don't have to read it. I'll go over the high points in a minute. But what we did is we identified the significant results of the project based on the logs and things like that they were tracking, the accomplishments, the finances versus the plan, the beneficiary satisfaction, the project team satisfactions, those things I just talked about, any other measurements that we came up with, and of course, where we could do things differently and improve those lessons learned. So I'm going to read these things. Positively impacted the lives of the people of Arusha. The lives would have a greater chance to be saved. Patient care and safety should be improved because of what they did. Techniques to provide improved care are better understood by the medical staff in multiple facilities, and the biomed and IT infrastructure was increased in reliability and sustainability. We also realized that there was a difference in expectation, which I just mentioned, and specific focus on setting expectations to and maintaining documentation for this is something that they're going to focus on going forward. I've just covered a bunch of those lessons learned, reviewing the goals ahead of time we talked about, coordinating the team leads, the communication between the director. We also talked about the accomplishments and communicating those expectations. These are fireworks on the left. Future improvements. We're going to improve security so all of the equipment gets there. We're going to process or document the process work so that it's more consistent. We've talked about it, they're doing it, but it needs to be documented. We need to actually schedule that time for training instead of just letting it happen. Help identify the commitment from the leadership, make sure that that's in place before they go. And then, yay, project management support. This is most fantastic. I didn't put that in. The team identified that one of the main future improvements that they needed to have was that they needed project management support. They realized that they got so much more out of this mission compared to prior missions. Now, they didn't have anything recorded from the prior ones so that they could compare, but from the perspective of just recognizing being there and seeing the difference, they were all very enthusiastic about having project management be a part of what they do going forward. And that leads to our summary and where this all ended up. Project management's organizational impact. So the really big picture. We talk about sustainability in terms of the team being able to reproduce the results. But there's also the concept of project sustainability. How are they going to be able to do this project over and over, this medical mission over and over? When we shared that impact report, I was asked to join a meeting with upper management. I was honored to be able to join this meeting, and it was so impactful for me personally. What was happening was that the leadership of the organization of SCL Health had started doubting the value of the missions. Now, they plan to improve the health of the people in the communities they serve, especially those who are poor and vulnerable. And of course, no matter what happens in these missions, that's going to be the case. However, with our impact report, we were able to share so much more. So they invited me to kind of go through the impact report with these leaders and help them understand from an outside perspective what I saw. And the team had already shared their opinions, and I shared mine and the impact report with these leaders from SCL Health. And of course, our involvement improved the team's impact, but it led to continued support of the missions because the leadership heard from us, saw what we recorded, and decided that they wouldn't cancel the missions. They were thinking it wasn't worth the effort. It wasn't worth the money. Now, of course, how do you measure the money against this huge value that's personal and health related? But they decided that with such great impact and the opportunity to improve where we go going forward, they were absolutely going to invest more in their missions. And on top of that, they decided that they would hire a project manager. I'm so proud and happy to have been part of this project and have been involved in this effort. The whole thing is huge, but even at the end, when you look at my goals and our goals from a project management perspective, we really accomplish the goal of making the world a better place through project management. Thank you very much.